And this is where we ended up last time talking about body dysmorphic syndrome, and one of the possible body dysmorphic syndromes is anorexia nervosa, another one bulimia. And this, I've already talked a little bit about Karen Carpenter. She was just a beautiful voice. The Carpenters, which was her band with her and her brother, they sold more records in the United States than the Beatles did in their time frame. They were the #1 best-selling American group, 1970, 1980. So this is her in 1979. She's already had 2 bouts of anorexia, and then in 1979 she was fairly clear of the anorexia, and then she started to go back into it. She got married in 1980. She got divorced 1 year later in 1981. You can see her hair is absolutely gorgeous in 1979, is really pretty in 1980, but then you're seeing a little bit of a loss of protein, and then in 1982, a huge loss of protein. The hair is no longer able to hold its form and shape because it doesn't have any protein left in it, and she died just a little bit after this picture was taken. You can see the cheekbones. You can see her jawbone. She's gaunt. She has no fat left on her, and when you lose the fat, that's the first thing that the body's going to use is fat. That's an easy source of energy. And then when all the fat is gone, it starts to eat whatever it can to get more energy. If you're not eating yourself, if you're not metabolizing any carbs, then the brain absolutely needs the carbs to be able to survive, and the body. And so it will start to eat muscle and organs, and you do damage to your internal organs and your muscles, and the heart is a muscle. And so eventually you're going to end up with not a pretty end. And you will not live as long as other people do, normal population, because of the damage that you've done through anorexia. She was fixed twice already. This is her 3rd bout. Remember, I said that there are certain reasons why people have anorexia, and you can fix the anorexia supposedly, but if you don't fix the reason it came about, then it's just going to be resurfaced again. And no one knew what anorexia really was back then, and so her parents decided to allow her face to be the face of anorexia, the poster child for anorexia, so that people started to understand what anorexia was, because in my day she was extremely famous. And so people were like, why did she die? Anorexia. What's that? Now we started talking about it. And even doctors did not know what anorexia was at that time. So bulimia is very similar to it. It's people who will eat, where anorexics, you do not see them eat. Bulimics, you will see them eat, but they will have taken laxatives beforehand so that what they eat goes right through them, so that it doesn't have time to metabolize, and they don't get the carbs that they just ingested, or they will throw up. They will stick their finger down their throat and throw up in private, so you don't know. And so you see them eating. It's very difficult to know that they are bulimic unless they state that they are. You catch them in the act. Of course, purging or throwing up means that you get stomach acid in your esophagus out through your mouth, and it does damage to the esophagus. It does damage to your teeth and your gum line. Although our gums do bleed occasionally, they are, when we brush our teeth, if you are cleaning your teeth, there are times when your teeth will bleed, but it's a very minor bleeding. So if your gums have been damaged by acid from your stomach, then they will continue to bleed, and they will be a deep connection into your bloodstream, and your astrocytes will only be able to work to cure you, to fight the infection for a little while. And if your mouth bacteria and viruses get into your bloodstream for a long period of time, over time you're going to get sepsis or a full body infection. So you need to be careful. It's just, there's nothing you can do about it. If you're a bulimic, it's eventually going to destroy your gums. And of course, the damage it does to your esophagus means that later in life you have a higher chance then of getting esophageal cancer as well. So there are other reasons why it's bad for you besides the fact that you lose weight to the point where your body starts to destroy your tissues. And that's body dysmorphic disorder. Are there any questions about body dysmorphic disorder? Okay, I'm seeing a lot of no's. All right. So let's go to schizophrenia. There are 4 different types of schizophrenia. We'll talk about all 4 of them. Plus, each one of those can be positive or negative. We'll talk about what that means. And then there's a residual type. This is a psychotic disorder involving distortions in thoughts, perceptions, and or emotions. It is a split with reality, and it occurs between 25 and 45 in women. So it's older in women, 25 to 45. But in men, it occurs up to the age of 25 and then not normally after the age of 25. And that's the normal distribution curve. There are people on either side of that. 40% of all admissions to mental hospitals. Admissions means somebody that goes in and doesn't get to come out for a long time. 40% of all admissions to mental hospitals involves schizophrenia of some kind. 1/3 of all cases remain active for the rest of their life. 2/3 of the cases show deficits, and some recover, but you are not allowed to recover from schizophrenia. What do I mean by that? What I mean by you're not allowed to recover? If it gets onto your medical record that you are schizophrenic, it will be there for the rest of your life, even if you are no longer schizophrenic. Because according to psychiatrists, once you are fit schizophrenic, you will always be schizophrenic. That is not right. Not only is it poor policy, but there was a psychologist who was so opposed to it that he taught his students to pretend to be schizophrenic, sent them off to different medical facilities where they were going to pretend to be schizophrenic and get placed into the mental health wards in those hospitals. Then at that point, they were told once you get admitted, don't show any signs of schizophrenia anymore, and let's see how long it takes them to let you go. And it took months and months before they were let go. And one of the students, they actually wrote down everything that was happening. And one of the nurses at the Mental Health Institute said, oh, this is called note writing behavior, as if that's wrong. They were just trying to make it so it sounded like they had a reason to keep that person and that they didn't make a mistake by putting them in there. And it does not come off of your record. And that is incorrect. Especially another case where there are certain drugs that will increase the amount of dopamine in your brain. They do one thing, they have a side effect. The side effect is it increases the dopamine in your brain. So you're taking it to fix something, but then it increases the dopamine in your brain, and when that happens, you appear to be schizophrenic. But as soon as you get off of that drug, your dopamine levels come back down and you're not schizophrenic anymore. Too bad. It's on your medical record and it isn't coming off of your medical record. And that's just wrong. So here are the 4 major types: disorganized, catatonic, paranoid, and undifferentiated. And then the residual type, which is people who are not showing any signs of it. And then positive and negative. Any one of these 4 top can be either positive or negative. So the disorganized features incoherent speech, hallucinations, delusions, and bizarre behavior. John Nash was a mathematician, and in college, he had a roommate in his 2-bedroom apartment in the dorms at the university. And he didn't have anybody. There was no other parent. He had a roommate that he talked to, he went out with, they went to different parties together, they went out eating together, they did all kinds of things together. There was no such person. There was no person. And yet, John Nash got a Nobel Prize in mathematics. It isn't that they're incapable of thought or logic. They just have this issue, and they're seeing and hearing things that really aren't there. There's a drummer who is schizophrenic, and he takes drugs to help him to alleviate the symptoms. But basically, they're downers. They put him down. And he says, I'm not a good drummer while I'm on those drugs. So he takes the drugs during the week. And then on the weekend, when they play gigs, he's off the drugs so that he's a good drummer. There are artists that are just amazing artists because schizophrenics think differently But the fact that they think differently makes it difficult for them to navigate society and navigate the world. And so they have a pathology because it causes them distress and the inability to meet important goals in life. So Talking to Imaginary People is also Harvey, the movie Harvey, and the play Harvey. Jimmy Stewart, who was an actor in my day, played Elwood P. Dowd in this movie called Harvey. And Harvey is a invisible 6-foot white rabbit, and Elwood P. Dowd's best friend. It's 6-foot white rabbit. And I'm going to show you this video. Let me bring up the video. I'm going to show you a video. And this is Jimmy Stewart playing Elwood P. Dowd. And let me make sure I've got, yes, I do, so you can hear it. He is at a party. He gets tired of the party, so he goes out to sit in the alleyway outside the party. And his psychiatrist and nurse are both at the party, and they come out with him. And the psychiatrist asks him, "How did you meet Harvey? What happened when you met Harvey for the first time?" And this is his answer. I'm going to turn off my microphone so I don't get any reverb.
It was a rather interesting coincidence on that, Doctor. One night several years ago, I was walking early in the evening down along Fairfax Street, between 18th and 19th. You know the block?
Yes, yes.
I just put Ed Hickey into a taxi. Ed had been mixing his rye with his gin, and I just felt that he needed conveying. Well, anyway, I was walking down along the street, and I heard this voice saying, "Good evening, Mr. Dowd." Well, I turned around, and here was this big 6-foot rabbit leaning up against a lamppost. I thought nothing of that, because when you've lived in a town as long as I've lived in this one, you get used to the fact that everybody knows your name.
Yeah. It isn't the fact that there's a 6-foot white rabbit talking to him, but the fact that it knows his name that is a little bit concerning. And that is typical for a disorganized schizophrenic. All right, so that is disorganization. Catatonic schizophrenia is when a person goes into like almost a coma or into a petit mal seizure. We all are familiar with the epilepsy grand mal seizures, but the petit mal seizure is when a person just sort of stops talking and then keeps on going as if they're in some sort of a trance for a second. That's a petit mal seizure, and the catatonic state is very similar to that in catatonic schizophrenia. So it involves stupors or extreme excitement also. In the stupor, the person can be motionless for hours, and in rare cases for days. And there was a movie in 2001 with Brittany Murphy called Don't Say a Word, where she faked the catatonic schizophrenia to escape men who were trying to torture her, kidnap her, and kill her for the information that she knew. And she decided if I got put into a mental health ward, they couldn't get me. So she purposely pretended to be catatonic schizophrenic so that they would put her in the mental health ward to save her. And unfortunately, the doctor had children, so the bad guys kidnapped his children and said, "Get her out or we're going to do damage to your children." And so he went in and he raised up her hand, and he did to do an intake sort of for her, and raised her hand and let it go, and it dropped down to her lap. And he went, "You may have studied catatonic schizophrenia very well, and you're mimicking it pretty good, but that's not catatonic schizophrenia. Because in catatonic schizophrenia, their muscles are just tense. So if you move their arm in any way, shape, or form and let it go, it's just going to stay there. You can stick their finger up their nose, and it's just going to sit there in their nose while they're in the catatonic state." So this is, and the rest of the story, if you want to watch the movie, I'm not going to tell you because it's nice. It's a good movie. But that's catatonic schizophrenia. Now, the disorganized and catatonics are not very dangerous people, but a paranoid schizophrenic, if you deny their paranoia, if you try to fight their paranoia, they're going to get dangerous on you. So prominent feature is a combination of delusions and hallucinations. no catatonic states exist. A paranoia exists based on illogical and unorganized delusions. And there was a great movie that showed this. I'm not too fond of Mel Gibson as a person, but he's an excellent actor. And he played a paranoid schizophrenic in the 1997 movie Conspiracy Theory. If any of you have ever seen that movie, excellent movie demonstrating what a paranoid schizophrenic is really like. But even though he was a paranoid schizophrenic in that movie, and paranoid meaning he thought people were out to get him, there were people out to get him. There actually were people out to get him. Just because you're paranoid doesn't mean they're not out to get you. And it was the CIA. They had he knew some information that a group in the CIA did not want anybody else to know. So they figured rather than kill him, they could just make him paranoid schizophrenic by giving him certain drugs. And then anything that he said would be completely, nah, that can't be, because he's a paranoid schizophrenic. So of course he does that. Conspiracy theory. Right? So that's a paranoid. Paranoids also, they have trouble getting any help because they're paranoid. They think that you're trying to control them or kill them or do something to them. And yeah, well, we're trying to control your symptoms, but we're not trying to control you as a person. So that's paranoid schizophrenics. The undifferentiated can also be dangerous people because they do have the paranoid delusions as well, but they're also catatonic. They also have disorganized features. So they have a whole group of features. You can't just say this is the type. So we call it undifferentiated schizophrenia. And then the residual group is those people who are free of the most extreme symptoms. They may be completely free of all symptoms, and some of them are mildly disturbed or emotionally impoverished, but that's about it. And no one is ever considered cured once they have been diagnosed with schizophrenia, so they had to come up with this term, residual type schizophrenia, since they don't have any kind of symptoms sometimes, but we can't call them, we can't say they're clear of schizophrenia, so we call them residual type schizophrenias. The positive and negative sides. Positive is any form in which the person displays the active symptoms, so they're the disorganized, talking to people that aren't there, catatonic, showing that stupor, the paranoid specific types. They're showing all the particular symptoms of that particular type. That's positive. The negative style is we know that this person has this particular disorder, but they are free of any really big issues, almost like a residual type, but they are showing some issues as a form distinguished by deficits such as a withdrawal or poverty, which means a lack of thought processes. Now, concordance rate is a word that means, it's a term that means the percentage of family relatives, that's blood relatives, not people born, not people married into your family, but people born to the same bloodline who show the same trait because it's a genetic disposition. That means a child of a parent with schizophrenia is 14% more susceptible to getting schizophrenia than the normal population who has no one in their family that has schizophrenia. They're 14% more capable of getting it. Now, if you have two parents, it's not 28%, it's 40%. If you have two parents with schizophrenia, you have a 40% greater chance of getting schizophrenia. But if you have an identical twin, it's not 100%. So it's not all genetic. It's only 50%. And this brings up the nature-nurture debate again, which is more important, nature or nurture? Well, if you have genetics, you have a potential of getting it, but the environment is going to determine whether you get it or not. So 50% if you have an identical twin who has it. And we studied people who are identical twins. One of them with schizophrenia, one without. And the most famous is the two male twins in England. Of course, males get schizophrenia before the age of 25. Well, the one who got schizophrenia was in college and tried LSD, and they're walking the fence because their parent, they had a mother who was schizophrenic, so they already have a 14% chance of having schizophrenia greater than the normal population. He's walking that fence, he takes LSD and falls off onto the side of schizophrenia. So it's genetic factors placing an individual at risk, but environmental stress factors transform the potential into an actual schizophrenic disorder. The diathesis stress hypothesis is for any genetically controlled pathology. you have the factors that could put you into that particular like depression and the serotonin gene. You have the capability of becoming depressed more than the regular population does. And so if the environmental factors come along that push it through, then you're going to get depressed, or you're going to get schizophrenia, or you're going to have OCD. So whatever the genetic trait is that is passed down to you. Brain scans of the identical twins in England showed that one of the twins, the one that had schizophrenia, had a brain that was 10% smaller than his brother's brain. But they're identical twins. Their genetics is identical. So how can they have different sized brains? And they studied these two very extensively and went back to their birth records. And it turned out that the twin who had schizophrenia had been born a blue baby. Their umbilical cord was kinked. And so even though they're identical twins, growing up in the same womb, their environment is different, because the one with the kinked umbilical cord does not get as much oxygen as his brother does not get as much nutrition as his brother does, and does not have waste products efficiently removed like his brother did because of the kink in the umbilical cord. And so they did not have the same environment in the womb, and that means they did not grow up identically, even though they had identical genes. And I have the video online if you want to see it in my lectures. So you can see that information about the schizophrenic twins in England. That's the end of schizophrenia. Any questions about schizophrenia? I'm seeing lots of no's. No's. Any questions at all? Just type it in if you do have a question. So now we get to personality disorders, are really interesting disorders also. And this is where we find the male issue that is 4 times more prevalent in males than women. We've seen most of these women have it more often than men. Well, there's one coming up that men have way more often than women do. So personality disorders are conditions involving a chronic, pervasive, inflexible, maladaptive pattern of thinking, emotion, social relationships, or impulse control. The first one that I want to talk about is the narcissistic personality disorder. These people are characterized by a grandiose sense of self-importance. Self-importance meaning, I am God. I am the best thing that you could ever imagine. I am everything to everybody. I am God. A grandiose sense of self-importance. A preoccupation with fantasies of success, always thinking about being the best here and there, and whatever I'm doing, I'm the best in it. And a need for constant attention, always wanting somebody telling them how great they are, there's all kinds of other symptoms as well. But these people respond to criticisms inappropriately. If somebody wakes up one day and they're late for school and they come in and their hair is a mess, like, what, you get up late, your hair's a mess. These people would punch you in the nose. Inappropriate to the criticism that you just got. I'm teasing you, your hair's a mess. You need to go to the bathroom and fix your hair up, because you were late, obviously, getting out of bed. You just rushed over here. So, yeah, thank you for telling me that, getting punched in the nose for saying that is completely inappropriate. So they can also feel entitled to favors without any obligations. Like my next door neighbor just recently helped me to build my deck. And I'm extremely grateful for the fact that he came over and he helped me to build my deck. And anytime he needs help, I'm going to return the favor. I'm going to help him. Right? But these people are not like that because they believe I am God. And so when you help them, they don't think of it as you're doing them a favor. They're doing you a favor. How many people get to help God? I allowed you to help me. You should thank me for letting you help me. So they don't feel like they owe you anything in return. And because of that, they exploit other people all over the place. and they're unable to understand other people's feelings because they don't have the right, they don't know how to react to other people because it's all about me, 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 me. Narcissistic personality disorder. I'm sure you know people that are like that. This is where we come to the antisocial personality disorder. Men are 4 times more likely to acquire this disorder than women are. And these are pretty nasty people. So characterized by a long-standing pattern of irresponsible behavior indicating lack of conscience and a diminished sense of responsibility to other people and animals as well. People and animals. So some children will take a magnifying glass, get the sun on the magnifying glass down to like a little laser beam and fry insects on the sidewalk, worms and ants, but eventually they feel bad about doing it and they stop doing it. Not an antisocial personality disorder. They get bored doing it. They want to do something worse. And so they go and find a cat, tie some firecrackers on the cat's tail and light it on fire, light the firecrackers off and watch the cat go crazy because there's firecrackers going off on their tails. And then that gets boring. So let's just pour gasoline on the animal and light them on fire and watch them die screaming to death. It gets worse and worse and worse. They'll take cigarettes and start burning the other children their age in their little community. They're doing some really bad things, and it's just getting worse and worse, and until they will eventually get arrested for it because they're doing damage, they're doing illegal acts, right? And now, of course, it is illegal to set a cat on fire. But these people do not experience shame or intense emotions. Their brain mechanisms are not like other people's brain mechanisms. And 2 to 3% of the population has this disorder. Multiply 2% times 300 million. You know, that's a lot of people who have this disorder. But not all of them become criminal. And those who do not become criminal would be really good lawyers and senators and House of Representatives and would fit really well in the White House as well. And I'm not joking about that. I'll give you an example, okay? But sociopaths and psychopaths are this type of person. Psychopaths and sociopaths. And there's a difference between the two, psychopaths and sociopaths. Sociopaths do not plan their activity. They just take advantage of the activity that exists in front of them. Psychopaths plan, and they're dangerous. They're very dangerous. The sociopath, for instance, if you are very religious and the sociopath is not, every time they see you, they'll pick at your religion. They'll tell you how stupid you are for believing in invisible God, you know, things that don't exist. And they just pick until you finally go off on them. And then as soon as you go off on them, they're like, and what's wrong with you? As if it is your fault that you went off on them for them nitpicking at you all the time. So that's a sociopath. And they don't think about it. They just take advantage of the situation that exists in front of them. Psychopaths plan. They don't like religion. You're religious. They're going to wait and plan, get all the materials they need until you're in the church, lock the door, and burn it down. They're dangerous. They're dangerous people. Psychopaths. They can be. And why do I say they would make good lawyers and other, well, I have a cousin, had a cousin, second cousin in California. He was one of the best lawyers, defense attorneys in California. He never lost a case, ever. He never lost a case. He won every case to get his clients off or reduce their sentence. And his clients were mafia. First of all, he was defending mafiosos who had murdered people or committed other kinds of crimes, and he always got them off, and he slept like a baby. I'm sorry, I could not do that. It's his job. I don't care if you killed somebody. That is completely irrelevant to the fact that I am your defense attorney and my job is to get you off. It does not matter if you did the job or not. I'm here to get you off or reduce your sentence as much as possible. I couldn't sleep at night, but a sociopath, a psychopath, they could sleep at night. Antisocial personalities, they have no problem. They don't feel shame or intense emotions. And the prosecuting attorney is the same way. It is my job to get this person in jail or make sure that the sentence is as high as possible for them because the state says that they are guilty, and it is my job, therefore, to prove that they are guilty. Even if I have evidence over here that sort of makes a contradiction, I don't care. My job is to get you in prison. So even the prosecuting attorneys, good sociopaths and psychopaths, and of course, House of Representatives, Senate, Congress, hey, I'm making laws which will help this group of people and not help this other group of people. In fact, it might make it worse for this other group of people. But this group of people, I'm helping with this law, and I feel very proud of helping this group of people here, and I don't really care about those other people. Doesn't matter. I could not sleep at night doing that. How many of you have heard of Gary Ridgway? Any of you heard of Gary Ridgway? Some of you have, some of you have not. Okay. So this is called the Ridgway Green River murder case. Gary Ridgway had murdered 2 people, and the prosecuting attorney was fairly sure he had murdered a 3rd person, but they couldn't prove it. But the other 2, absolute evidence. There's no way that the jury will say that he's guilty. The jury is going to say he's guilty because they have absolute proof that he killed these 2 people, and they think that he killed the 3rd person, but they're not able to prove that one. And this state has the electric chair, so he's going to the electric chair. He's going to be killed. The defense attorney comes to the prosecutor and says, we would like to have the electric chair taken off, the table. We don't want the death sentence on the table. And the prosecutor's like, he killed 2 people. And we know, we're pretty sure he killed this 3rd person, but we don't, it's not positive. And the defense attorney is like, well, what if I could make it positive? What if I could close that case for you? The prosecutor's like, 1 case? No, I'm sorry. He's killed 2 people. He's going to jail. That 1 case is not enough. Well, the defense attorney says, how many cases do you want to close? What do you mean, how many cases do I want to close? Well, how many cases would it take to take the death sentence off the table? Right? And eventually, he was convicted of 48 prostitute and runaway murders, a serial killer. He was able to lead them to the bodies of 48 people whose parents or loved ones had no idea where they were, and close those cases for the state and bring closure to those families. And so they took the death sentence off the table in order to close those 48 cases. But those are the ones he was convicted of. He had another 48 cases that he couldn't lead them to the body. He had killed 96 people. 96 people. He's one of the most prolific serial killers in the United States. 96 people he was assumed he killed. 48 we know he killed. The other 48 he couldn't bring them to the bodies. And he had no remorse, none at all. The only time he showed remorse was when he was convicted and was going to go to prison for the rest of his life without parole. And then he was sorry for himself. And he thought, I'm doing society a favor. Society is being destroyed by prostitution, so I need to kill all these prostitutes. And he was told, but you didn't kill prostitutes. You killed any woman who happened to be walking down the road alone. Well, they should have been walking down the road alone then. There's a psychopath a person who plans, psychopath, not a sociopath at that point. Right? So that is antisocial personality disorder. Any questions about antisocial personality disorder? Had you heard that story about Gary Ridgway before? Some of you said you thought you had, so some of you have had. That amazing, just amazing what damage sometimes the brain mechanisms are in. There are people who we call the worried well. They are people who, for all intents and purposes, they're fine. They have one little problem that they can't handle that they need someone to help them with. Mild depression is one. I'm sure that everyone in the class has had some form of depression at some point, feeling down. But these people can't seem to come out of it. It's not suicidal depression, which is mild depression, but who wants to be in depressed state, right? The positive psychologists say, let's live in the positive side, not in the negative side. Marital problems, anybody who has been married, any of you who are married, know that it is not the fantasy world that Hollywood tries to make it out to be. There's always problems living with another person. And it doesn't matter if you're living with another person, by the way. Before you get married, you're still going to have that issue. Doesn't matter if you try the shoes on first, right? It does not work that way. There is, as I think I've said before in maybe the developmental section, when we get to developmental psychology, if you take that class 241, developmental psychologies, we talk about the way that people get to know each other, and we'll talk about this in the social psychology section here as well. But when people live together, they have a worse chance of having a successful marriage than people who wait until they are engaged. Once they're engaged, once they've made a commitment, then they have the same rate of success as anybody else, which is still only about 50%. But if you live with somebody first, you have a less chance of having a successful marriage. So marital problems. Physical complaints, the psychogenic disorders, pains that aren't associated with anything. Academic problems, every one of you can relate to that. Trying to get your best grade, trying to find the time to study, trying to find the money to pay for it. There's lots of academic problems. And the parent-child problems. Having a child is an absolutely wonderful thing. My wife and I were married for many years before we adopted because we couldn't have a child. And it is just a fabulous thing to have a child. She's now in 6th grade, and she's doing really well. She's got straight A's. Proud papa. It's not her fault, what happened to her and her family and put her into social care. But having a child, it's not an easy thing. And all of you who are children of parents, thank them and tell them how lucky you are to have them as parents. And all you parents, you know what I'm talking about, parent-child problems. Bereavement, loss. Now, bereavement is not necessarily loss of a person. It can be loss of a job. It can be loss of a home. It's all kinds of losses can cause bereavement. I remember my first house that I owned, my very first house that I owned. My wife's crying because we sold the house and we bought another house. We're going to go move into the other house. And I'm like, it's just a house. And when I closed the door for the last time, I broke down. It was just, it's bereavement, the loss of something that you have had for a long time. Even if it's a wonderful thing, it's still a loss. And malingering, we've already talked about people who use their issues, bodily issues, mental issues to get out of work. Shyness is not a pathology. For all you shy people, you can applaud now. Shyness is not a pathology. It is a symptom of other things if it becomes too great, right? In distressing pattern of avoiding or withdrawing from social contact. It is not by itself a DSM-4 or 5 disorder. It's never been in the DSM as a disorder, as a pathology, only a symptom of other pathologies. So if you can't successfully navigate, if you have agoraphobia, well, shyness might be a part of agoraphobia, but yes, of course, if you're feeling personal distress and you're not able to get along in society because of agoraphobia, then it needs to be classified and treated, but only as a symptom of that, not by itself. There are people who are gregarious. There are people who are shy. Either one is okay by itself as long as you can navigate society okay. So we classify people as either antisocial, narcissistic, OCD, depressed, anxious. We have all these labels that we give people, and ideally, an accurate diagnosis leads to the proper treatment, but diagnoses may also become labels themselves, labeling that person, depersonalizing the person, and ignoring the social and cultural context in which their problem arises. All right, so what's wrong with George? Just something wrong with George. Have you seen George? George is just weird. George is doing the thing. I don't know anybody like George. George is different. And everybody's talking about George. Somebody comes along and goes, George has Tourette syndrome. Oh, okay. And we're done. No, we're not done. At that point, we need to determine, okay, so how can we change our behavior, because we have control over our behavior, that will help George to live in proximity to us. What is it that we do that sets George's Tourette's off? Let's not do that anymore. So once labeled, we feel a loss of responsibility toward that person, as if the labeling process concluded all our responsibilities. Oh, well, we found the problem and labeled them, now we're done. And that's not the way it works. We need to help people. Plus, if we label somebody, sometimes they will actually behave like we labeled them. And the diagnosis of a disease can sometimes actually change the prognosis or prove the prognosis, sort of like a self-fulfilling prophecy. When you give a diagnosis, it becomes the prognosis. So I have my grandfather as an example of this. My grandfather, when he was a younger man, married, had children, he got cancer. Well, in those days, there was no radiation, there was no chemotherapy. The only way to get rid of the cancer was through surgery. So he went to the hospital to have the surgery to have the cancer removed. And when the surgeon came out of the room, this is before I was ever born, so my mom was a child at the time, the surgeon said, there's nothing we can do. The cancer has metastasized to too many organs. If we took it out, we'd kill him just by taking out all the organs that we take out. He has about 6 months to live. And the family said, you will not tell him that. Do not tell him he has 6 months to live. You will not say that in his presence. They said, well, yeah, but he's going to have, something to keep him comfortable while he's passing away. Well, we can just tell him that he's taking that stuff because you did the surgery on him, and he's going to need to take this for the rest of his life, until he dies, because he needs this drug to keep him happy, keep away the pain. But you will not tell him that he's died, that he has 6 months to live. So no one ever told him. Well, he eventually moved to Florida 12 years later, and a new doctor in Florida said, you have cancer, and there's nothing we could do. You have about 6 months to live. And he died 6 months later. The diagnosis led to the prognosis. You tell somebody that they're going to die and their stress goes up, they give up, they go through the 5 levels of death and dying, right? And you have created the symptoms for that particular thing to happen. And so giving somebody a prognosis of a mental health disorder sometimes leads to that mental health issue, the symptoms that are associated with it. And like I said, we treat some people one way, and that's what they become. So we'll talk about the fundamental attribution error later in the last chapter. But if you see a person on the street holding up a sign, homeless, need food, you think, oh, what a bum. meaning bum to us, meaning they are unintelligent and lazy. We have attacked their character without even knowing anything about them. That's the fundamental attribution error. They could have been a 60-year-old manager at a store, and COVID shut down their restaurant, and so they lost their job, and no one wants to hire a 60-year-old, if there are even jobs for, jobs out there right now. No one wants to hire a 60-year-old man because it takes too much money in health insurance to keep them up, and so they want younger people instead. Now, you're not allowed to ask on applications what their age is. That's against the law. You're not allowed to ask what their age is. But you can ask when they graduated from high school. Loopholes, which means they were 17, 18, or 19 when they graduated from high school, so you have a good idea of how old they are. So we start to treat that person as a bum on the street, and as soon as we do, if we over and over and over again, they actually take on the persona of the bum. So we treat them differently and they behave differently because of it. We don't even take into consideration the things that actually happen to them that cause them to be there. They may be a very intelligent, very hardworking person, but insanity is not a psychopathology. I know a lot of you are like, what are you talking about? Insanity is not a psychopathology. Insanity isn't determined by a medical doctor. It's not determined by a psychiatrist. It's not determined by a psychologist. Only a judge. It is a legal term. Only a judge can say that you are insane. We use it all the time improperly in our normal speech. And Hollywood loves to use it in their shows and say this person gets off because of insanity, right? You're not guilty by reason of insanity. But in reality, very few cases that try to use insanity as a plea get off. The jury does not believe it. But what it means is it's a legal term, not a psychological or psychiatric one, referring to a person who is unable because of a mental disorder or defect to confirm his or her behavior to the law. So the police are saying, why did you do this? I didn't do that. What are you talking about? I did not. I would never do that. I can't do that. That's not possible. You have the wrong person. I don't remember doing that. I can't. And so you had temporary insanity, and you are unable to tell that people anything about that particular event, but they have proof that you were the one who did it. No, that's not possible. I can't. So the psychologists will study you, or psychiatrists or medical doctors, to make sure that you are not faking it, that you actually do have this inability to confirm your behavior to the law. And then the law will say, okay, you had temporary insanity. You are not guilty by reason of temporary insanity. And then you don't go to jail, but you do go to a mental ward because you're insane. You go to a mental ward, but the mental ward only keeps you there until you are cured. And so if you're a really good person at pretending, you can pretend to be insane to get off, go to a mental ward for a year, and then get out of the mental ward because that you are cured. And then do the same thing again, and again, pretend that you are insane, get sent to a mental ward, do it again, get sent to a mental, do it again, get sent to a mental ward. In the trial, they cannot use any of the previous things because you are not guilty by reason of insanity. Therefore, they cannot use it in the next trial for the next jury. Instead, it should be guilty by reason of insanity. And then you still have to get sent to the mental ward until you're free and clear of that particular issue, but it can be used in the next trial if you do it again. And if you did it again and you certainly are actually insane at the time, you're a danger to society. You're doing this over and over again, unable to control yourself. You shouldn't be allowed out at that point. And I've been called to jury duty 5 times, never been on a jury, because as soon as they find out I'm a psychologist, they ask certain questions about me, and I'm like, that person if they did what you're saying they did, they're guilty. But no, they did it. They are guilty. The but comes in the sentencing portion. They are guilty. If they did it, they are guilty. Now, they might get off the sentencing because of the fact that some reason behind why they did it, but they did it, they're guilty, and they have never put me on a trial because of that. So I'm giving you a hint here, okay? If you ever get called to jury duty, it works, yeah, and I believe that true. If you did it, if you tripped somebody and they broke a leg, then you did it. I don't care if it was an accident. You did it. You broke their leg. Now, the sentencing portion, how should you be sentenced because it was an accident? Now, prove to me it was an accident. If you can prove to me it was an accident, then I will determine that their sentencing should be lowered instead of if they did it on purpose. But they did it. And that's the end of this section. Does anybody have any questions on this section before I continue with the next one? Nothing. Okay. No questions. All right. So the next one is the treatments. How we treat mental disorders. So far in this class, have you liked the class so far? Have there been things that you've actually learned that's useful in this class? Hopefully. I'd love to know what they are. You know, send me an email. Let me know what it is that you actually found useful in this class that you might use in your life, or that you think you know somebody better because of this class. I'm hoping really that you get something out of this class you could use, that this isn't just a useless piece of information you're trying to get. And in the treatments, I think with the treatment section, that really does take effect then. You see how people are helped when they have issues, and it turns out you, without being a psychologist, you can help people without even being trained, and I'll show you how in this section. But this section is about the treatments, and therefore I have on here hands reaching for each other, one person drowning, another person trying to pull them out. Right? In fact, in this, that's kind of interesting, because just a few years ago, there were some teenagers who witnessed a person who was drowning, and instead of helping them, they took their cell phones and recorded it. Instead of throwing their cell phones down and going and helping the person, they recorded the person drowning. And they got into trouble for this, but they didn't cause the drowning. But it is our job to help our fellow Americans and our fellow human beings and our fellow animals on this planet. And treatment, one of the things that, I was trained to be an animal psychologist, to help animals, not people. I'm not a therapist for people. Therapists have to have a division between you and the client. And I don't. If my client was crying, I'd be crying. So I know I would not make a good therapist for human beings. So this is the treatments for mental disorder. So the techniques of therapy are derived from solid scientific backgrounds, but the conclusions are derived from groups and averages. What does that mean? It means we can't purposely make a person have a mental disorder and then try to figure out what fixes it. That's immoral, unethical. I'm not sure that we could actually do it. Really get somebody just incredibly anxious and then try to fix them. No, what we do is we find people who have already had issues, who have had those issues fixed, and we have millions of examples to find out what works and what doesn't work. And does it work? That's a good question too. Does therapy work better than not having therapy? And that's another question we'll answer in this particular lecture. So it is averages, right? We're talking about the normal distribution curve. 68% of the people, this therapy works. Some, it doesn't work at all. Some, it works even better. But the 68%, this particular therapy works. So each individual is unique. We know that there are people on the edges, and some of those people on the edge, it just does not work for them. And we don't try to force them into the center. We find what works for that individual and give them an individual approach to it. Psychiatrists and psychologists have very differing approaches to therapy, and I've already talked a lot about that. We think very differently. The psychologist talks about the client relationship, and the psychiatrist talks about the patient model. So it's very different approaches to the way that we approach our patients and clients. Some of the reasons we just saw that people seek therapy to get help making difficult choices. For instance, career decisions. At the college, we have a test that you can take that will tell you what your career should be according to the test. And the way they do this is they test thousands and thousands of people who have all kinds of different jobs. And the ones who are very happy at their job, this is their particular psychological profile. If you match that profile, you'll probably be happy at this job. And I took that when I was in high school. And I was told I would be one of two things: a military officer, which made sense because my father was a commander in the Navy, and so I grew up around that thought process. And so military officer, and I actually started off my college in the Air Force, the ROTC, Air Force ROTC, but I wanted to be a veterinarian, and the Air Force had veterinarians, and so that was fine with me. They wanted me to be a pilot because I was up in the 95th percentile taking the tests for pilots and navigators, and they told me I should be a navigator because they needed more navigators than pilots. I said, I don't want to be a navigator. I want to be a pilot. They said, but the navigator tells the pilot where to go. I said, yeah, but the pilot doesn't have to listen to him. So I wanted to be a veterinarian, and they canceled the veterinary scholarships, and the only veterinarians in the military now are from the Army, and so I didn't want to be in the Army, so they canceled my contract so I could get out of being in the military. And my mom convinced me instead to go get my PhD, and which I never got either. But I got my master's degree at least. So to help making difficult choices like careers. Dealing with academic and social problems, you're all familiar with the academic problems, coping with unhappy relationships, depression, anxiety, the number one issue, the worried well we just talked about, and there's 300 different pathologies. So there's lots of reasons for people to want to get therapy, but there are a lot of different therapeutic methods. There's the talking interpretation methods, behavior modification. We'll talk about all of these. Behavior modification method, drug therapy, electric shock therapy, and even brain surgery. And today, we don't do lobotomies anymore, but we'll talk about lobotomies in this particular section. So some people who need therapy can't get it. They're unable to acquire the therapy. For instance, therapy is expensive. It's $150 an hour to go to therapy, but in North Carolina, at least, the state will pay a little bit of that $150 depending on your particular tax form. So if you bring in your taxes and show the doctor your taxes, they have a little scale, and it goes from $150 all the way down to $0. The state will pay all of your therapy session money if you qualify based on your taxes. How much money did you make last year? So don't let the fact that it's $150 an hour keep you from going to get your therapy if you need it, or if you know people that are saying, I can't afford therapy. Well, take your tax form in, show it to them, and find out how much it'll cost you. Maybe you can afford it, and possibly you need it anyway. So no health insurance. Lack of clinicians. There's a huge lack of clinicians. We need way more people. There are lots and lots of people who need therapy. If you go right here to one of our agencies in the area, you have a 6-month wait before you can get an appointment because they're so booked up because they don't have enough clinicians to deal with all the people that need the therapy. And of course, the clinicians have language barriers because, well, some people don't speak English. And I know a lot of my students say, well, you know, you're living in the United States, you should speak English because it's our language. Like, oh, that's a really huge misconception. Sorry, but the federal government has never, ever declared a national language for the United States. The United States has no national language. We speak English out of convenience because most of us speak English. but it is not the national language. Texas and Arizona have a state language. They've made English their state language, but the federal government has never declared a national language. So there are lots of people here. If you could speak Spanish, hablo español, pero un poco solamente, y no comprendo, which means I speak Spanish a little bit, but if you're talking it to me, I don't understand it. No comprendo. So there are language barriers. If you can speak 2 languages fluently, you have a very high chance of getting a job as a clinician. And then and also, what about the people? It's very egocentric to say, well, if you're in America, you should speak English. Well, what about people that come from Poland who are just here to have a good time? They're tourists and they have a nervous breakdown. There's nobody here that's a clinician that can speak Polish. So there are language barriers. And there are social and cultural norms also. What is a problem? You have a problem. Your family says, according to your family and your culture, this is not a problem, but it's causing you a problem and you need help. But nope, you don't even see it as a problem because of the cultural norm that you have. And the nature of the disorder can keep people from getting their therapy as well, because a paranoid schizophrenic will not take their medication. They think you're trying to control them or kill them. And an agoraphobic, a true agoraphobic, won't come out of their house. Well, we don't have house call doctors anymore, right? How do you get a person who won't get out of their house the help that they need, because we don't have doctors that make house calls like that. So it is, in some cases, very difficult to get the help that a person needs. And of course, sometimes you don't need professional help, and this is where every single one of you can help. When a person has a problem, sometimes all they need is a good ear. In the United States, we have a saying, right? 2 brains are better than 1. How many times has somebody talked to you and you've done, and this is, women do this more than men do, but yeah, oh, I'm sorry. I would feel the same way. If I was in your shoes, I would feel the same way. I understand. That's all you're saying. And they're talking to you and complaining about whatever it is, and you're just listening. And when it's over, they're like, thank you, because they feel so much better having talked it out. And guys, this is a big thing. Guys, when girls are talking to you about their problems, don't try to fix it. Listen to them. Listen to what they're saying. They want you to understand them. They don't want you to fix it. They talk it out. And guys just want to jump to the fix instead. Fast fix, right? So friends, mother, father, sister, and brother are all great sources of an ear. A lot of times a problem simply needs to be talked out. Have you ever heard the saying, 2 heads are better than 1? Because that's what it means, right? How many times have you thanked someone just for listening to you? That's all they did. But sometimes it's just too complicated, or the problem is too private. You don't want to talk to your friends about it. So that's when a trained therapist can come in and help. So what is therapy? Well, like I said, it takes a whole lot of different forms, but the common element, this is an important word, is a relationship focused on altering behavior and mental processes. The relationship is between you and the therapist. You have to trust the therapist. I mean, you're going to tell this therapist some really nasty stuff about you, the things that you don't like about you. And you have to trust them never to talk to anybody else and give your name out. You've got to have a trust develop between the 2 of you. And you also have to have some sort of connection. If you're a hippie flower child, long hair, and you walk into the therapy session and the therapist is in a 3-piece suit and tie with very short coiffed hair, you have nothing in common, nothing in common. But if you walk in and that person is also a long-haired hippie flower child, oh, Landsman, you're the person, you're just like me, right? So therapy is a general term for any treatment process in psychology and psychiatry, and the term therapy refers to a variety of psychological and biomedical techniques. Psychotherapy is a term for any of the psychologically based therapies, including behavioral insight therapies, and the psychotherapist's attempts to change disordered thoughts, feelings, and behaviors using psychological techniques rather than biological interventions. The most well known is psychoanalysis, the Freudian psychotherapy, where a person lays down on a couch and then somewhere probably behind you, there's a person asking you questions and writing in a book. Behind you, so you don't see them writing in the book, because as they write in the book, your stress is just going to go up because of that. And you must find a therapist you can trust and a method with which you are comfortable. Again, the therapist relationship is really important. It's especially if a person is a therapist and they've been a drug abuser, and they have had drug abuse therapy, and they've come out the other end, and they're no longer a drug abuse therapist, a drug abuse user, and so they are now a therapist for people who are drug abusers. When the drug abuser client says something and the therapist goes, I understand, the client knows you understand because you were there. Somebody with PTSD who's come out the other side is a great PTSD therapist, because those people know you know what they're talking about. And you can make that connection to the other person. But you also have to have a method you can try. There's lots of methods, and we'll talk about them here. But the rational emotive behavioral therapy is really intense, in-your-face therapy, and some people cannot go through that. And so you've got to find the method that you can go through, as well as the therapist that you can deal with, you can relate to. So it also helps to believe the therapy will work for you. How many times? Why would you go to therapy if you believe that it's not going to work? A negative attitude in therapy is going to hinder the process. So why would you even go if you think, well, this is not going to work? Any of you have an idea in the chat box? Any of you have an idea why you would go to therapy if you didn't think it was going to work? You're forced to. That's a great one, because I'm going to come up with that one in just a minute. Anybody else? Nobody else has any idea. How about you just love somebody enough that you want to go to therapy so that you could stay together, because your relationship is breaking down and you got to find out why. But the other person really doesn't believe in therapy, but okay, I'll go to therapy with you. I don't believe this is going to work, but that's, that happens. Or how about children? There's a forced one, Anna. The child's having problems. Child doesn't believe it's going to work, but the parents are making them go because the parent has control over that child. But I like this one. This is the best one, Anna. This is the forced one also. You're going to therapy or you're going to jail, says the judge after 13 DUIs. You're going to jail, or you can go to therapy, but you're going to one or the other. You got no choice. You got, those are your two choices. Those are the only two choices. You're going to therapy or prison. Which is it going to be? Well, who's going to choose prison, right? So you're going to choose therapy, but you don't believe it's going to work. And you're going to go for 26 sessions, and 12 of those sessions are just going to be used up trying to get you to believe this is going to work and connect with the therapist. So you've lost half of it. And that's alcoholism. Alcoholics don't believe that they are, they believe they have control over the alcohol, that the alcohol is not controlling them. That's the first step in AA, is to admit you are an alcoholic. The alcohol has control of you. You did not have control over that alcohol. So the 4 goals of therapy are not as easy as they seem. Identify the problem. What's the problem? Why are you here? The judge made me come here. The judge? Why were you before a judge? The police officer gave me a ticket. Why did the police officer give you a ticket? He doesn't like me. What do you mean he doesn't like you? How do you know he doesn't like you? He's giving me 13 tickets. That's why he did. Well, why does he keep giving you tickets? I'm not telling. So identifying the problem is not as easy as the client seems to make it out sometimes. And of course, alcoholism is one of the big ones. So then, okay, they're alcoholics. Why are they alcoholics? Are they self-medicating? Are they depressed? And that's why they're alcoholics, because the alcohol is helping them to get rid of their depression or anxiety. So they're using self-medication. They're self-medicating. They're using the alcohol to get rid of this issue that they know they have. They can feel it, but they can't really express it well. Well, if that's the case, then yeah, we'll probably be able to help them. How about it's their ancestry, right? Now, my ancestry, I have a genetics that, Ashkenazis, I have genetics that alcohol causes me massive headaches. So I will never be an alcoholic. Oh my gosh, the headaches are horrible. So, but that doesn't mean that I can't be addicted to something else besides alcohol. So, but I'll never be an alcoholic. So identifying the etiology. Maybe their parents were alcoholics. And so that's the behavior pattern that they're used to. And so they just became an alcoholic because that was what everybody did, and they got rewarded for being an alcoholic. And so that's what they're doing today. And so, yeah, we can fix that. We can heal you of this particular issue. So we make that prognosis. Can we help or can we not help? Well, if the person's schizophrenic, we can't help them. We cannot fix schizophrenia through therapy. We can moderate some of the behaviors through therapy, but they need drugs. They will need drugs. And so we need to get a hold of a psychiatrist immediately so that we can get them to be seen by the psychiatrist. So the prognosis, can it be treated successfully by us? That's the third point. And so if it can, then we will go through the treatment process. If not, we will find somebody immediately who can help them. The contemporary approaches, psychological therapies, psychotherapies, also known as insight therapies, are based on psychological principles as opposed to the biomedical approach. And there are a number of those: behavioral therapy, cognitive therapy, psychodynamic therapy, and humanistic therapy. And we will look at each one of those. The behavioral therapy attempts to modify behaviors using the ideas of classical and operant conditioning. We've talked about those in the learning chapter. Learned behaviors have to be unlearned, or we can learn new behaviors that are the opposite of the behavior we want to get rid of. Then these, we are learning and we are being rewarded for, the rewarded for behavior will increase. And since this is an opposite behavior, it will decrease. So we can overlay patterns of behavior on top of people. And the talk therapies, cognitive therapy, tries to restructure how a person thinks and focuses on beliefs, values, and emotions and thought patterns. And then psychodynamic is Freud's psychodynamic, also the talking cure, psychoanalysis. It's the best known example of this particular type of talking, and we'll talk some more about those. Humanistic therapy, therapists assess the client's self-concepts, needs, and values, and therapy attempts to increase self-actualization and self-esteem by assessing the power of choice and realizing the burden of responsibility. You are here right now in this class because of the choices that you made. If you don't like the class, it was your choices that led you here, and you're responsible for the choices you made. If you're in a therapy session, you are in that therapy session because of something that happened, and you have made choices that led you to that point. And yes, there's always two choices. Life or death there's absolutely two choices. You chose life. Good job. Now, this is the problem because you chose life, and that's a good thing you chose life. But you did, and now the responsibility is yours to live that life. So we'll talk about some of these therapies. Biomedical therapies, of course, are the kinds that go through biomedical types therapy treatments and focusing on altering the brain through drugs or psychosurgery, electroconvulsive, magnetic therapy. We'll talk about all of these in this particular section. And that's about the end of this class. So if you have any questions, please ask the questions in the chat bar or just unmute yourselves and talk to me. We do not have class next Thursday, but we do on Tuesday. So I will see you next Tuesday. Bye. Stay healthy. Have a good weekend. Jamari, Caitlin, any questions? Nope. Jamari?
No, I don't, sir.
Okay. All right, then. Have a good weekend. Bye.